Just a quick message to update everybody. So we've gotten all of the different sizes now for the Philips cuffs that go with the new monitors. Every bedside and emerge should be stocked with all of these. In ICU, I've got a supply of the infant ones. I've got about 3 or 4 in various locations. So under the cupboard where we usually have spare cuffs, I've put a selection of spare cuffs there, as well as a couple of infant cuffs on the pediatric cuff as well. Yeah, and then in the emergency department, we have them in the isolation rooms, in all of acute and in recess, as well as on the crash cart, and we have a supply in the cabinet over there in case you need extras. Biomed has a supply as well if ever we run out of supply. Biomed has some, and I do have some stuff in my office as well. So just so you know, they are now available everywhere. Also wanted to update you guys. So I bought these new clips for the art lines. So again, you're going to slide your cassette in. Unlike the ones I had previously bought, these ones fit nice and tight, so they will hold on to your cassette. Keep in mind, you want to make sure that you adjust your bed or this clip to the same level as the phlebostatic access on your patient when you're doing art line monitoring. I'm looking into leveling options right now. I'm going to follow up with that when we get a chance, but at minimum, do try to level it to the best of your abilities. So in anticipation that we might see a surge of pediatric respiratory patients in the emergency department, we've made sure to include all of the sizes for pediatric patients for Airvo nasal cannula. Just a reminder, when you're fitting these nasal cannula, you want them to be 50% of the size of the nair. So look at the child's nair, and then select a nasal cannula that is not going to completely fill that nair, but be about half of the space, plus or minus a little bit. So that's basically just the update on that. I am going to also attach a little link on how to switch to pediatric mode for you guys.
Press and hold the mode button for 5 seconds.
Okay, so I wanted to show you guys these little sucker devices. So basically they're pediatric suction devices. So the blue sleeve part is actually just a cap. And if you remove that, inside of there, you'll have this sort of rubber supple suction device. So it's fairly well sized to do suctioning on a pediatric patient. So you can suction the nairs or orally as well. Basically, you activate it the same way you would with a regular suction device. You've got a hole here at the top. You'll occlude the hole to divert the suction to the tip. And then when you're not suctioning, you can pull it off. Again, recommended to hyperoxygenate a patient if you're going to be doing some excessive suctioning. These are a great device for, secretions in the nose and secretions in the mouth, and just generally clearing a pediatric airway. So, yeah, we have these